as Kevin mentioned a moment ago, exercise is really important and diet may be secondary. I don't know. I think diet is pretty important when it comes to PAD, but it doesn't have to be as difficult to manage as some may make it seem. To help you to get started, please welcome the Way to My Heart's Chief of Wellness from Wellspring Natural Medicine in Florida, Dr. Adriane Hines.
Hi, Kim. Thanks so much for having me. I'm so excited to be here.
Thank you. PAD warriors really struggle with choosing diets. There are so many different ones out there. Can you just break it down for us?
Yeah, absolutely. You're absolutely right. There are so many different diets out there, and it's really hard to know which one's right for you and what will work well. Before we jump into diets, I want to say that when Kevin was talking earlier and he was talking about personal responsibility, that's really, really important. And especially with diet, you have to be realistic with yourself as far as your expectations with a diet. And I don't even like the word diet. I like healthy eating options because we want to be having healthy food that we're eating, right? We don't want it to be a diet. A diet has such a negative connotation with it. Like it just is, there's always rules and restrictions. And that's what we'll get into when we talk about some of these diets is they're all based on a set of rules and restrictions that you have to follow in order to be within this diet. And I think that if you can empower people with healthy eating options, that gives them the responsibility and the power to make the right decision. So that's what I'm here for. I'm here to really help empower patients to make good decisions, but really we just don't have anyone educating them on what are their options. So we're going to go through a lot of different things today about diet. We're going to talk about different options and we'll just kind of jump right into it. So I think that the most important aspect of health really is diet. And the reason why diet is the utmost importance in my office is because diet is going to send signals to our body. So if you are eating nutrient poor foods, you're going to be sending inflammatory signals throughout your body. And that's going to create diseases and all kinds of different processes that we definitely don't want, right? If you're eating really nutrient dense foods, then you're going to be giving your body the vitamins and minerals that they need to help fight off diseases and to help make sure that you're functioning at an optimal level. So let's talk about the different diets that are really kind of common. Paleo is a newer on the scene kind of diet. It's really based off of Paleolithic era and what we would eat during a hunter-gatherer society. So really big on meats and veggies in there. Mediterranean, that's been around for a really long time. And the reason why Mediterranean works so well is because it's based off of having a lot of polyphenols from olive oil. Now, here's the thing to point out about the Mediterranean diet is the Mediterranean diet, I don't know if you guys have ever been to Italy, but that was one of the things that I noticed when I was there is they finish everything with a really good olive oil. They're cooking with olive oil, but they finish with olive oil. And it's really that unrefined, uncooked olive oil that really helps set things apart with the Mediterranean diet and finishing things. And anytime we're cooking, we're going to degrade not only the nutrients of the food that we're cooking, but we're also going to degrade the oils and stuff that we're working with as well. So they don't have as much nutrients. Another common diet right now that's taken on is keto, which is really high fat. The problem with some of this is that you have to stay within a certain range and it really becomes really restrictive and can become problematic. So again, I kind of advise against that one just because so many rules. Vegan's really trendy and common now too. And I think that a vegan diet is great in moderation potentially. And if you don't have a methylation SNP, if you have a methylation SNP, you're not going to get enough B vitamins from a vegan diet. So then you make things worse within your body, especially creating more homocysteine or having problems breaking down homocysteine. And we know that homocysteine can be a bad thing, especially in our PAD patients. So we want to make sure that we're supporting this methylation cycle. So nothing against taking vegan holidays. Right now, I am on a juice fast. So I am having nothing but cold pressed vegetables all day and no food. And that's great because it's giving my body a time to reset. And I think that's a good option for other people as well. And that's a good way to get in extra veggies in your diet. The other diet that's really common with PAD is the Dean Ornish diet, which is more low fat, low carb, low proteins. But again, we can run into the problem with that methylation cycle. So I would be, kind of mindful about that. Okay, so let's talk about diet. Let's make it more simple. So again, I want you to set realistic goals. I want you to be realistic with yourself. If you're one of those people that, you constantly are craving donuts, or you're a chip person, we need to know how to get around those cravings, how to satisfy those cravings with other foods that are healthy and that actually give you vitamins and nutrients. So let's talk about some basics. Veggies should be the core part of any diet. And we want lots of veggies. When I ask my patients, do you eat vegetables? They're like, oh yeah, I totally eat vegetables. I eat broccoli and carrots and maybe a salad. And I'm like, well, that's great. That's a good start. But there's a lot more veggies than just broccolis and carrots. So we want to make sure that we're eating the rainbow. It's not for Skittles. Skittles is not the rainbow. Vegetables, that's where we want our rainbow. We want lots of colors because each different color vegetable is going to have different phytonutrients in there. And that's going to be really great to have a good diversity within our diet. So make sure you're eating lots of good, colorful veggies. And with a good kind of way of looking at your plate is really 2/3 of your plate should be non-starchy vegetables. And so with those non-starchy veggies, we're going to add in some good clean meats. Now, one of the complaints that I get with patients about switching over to really good quality meat is that it's more expensive. I completely understand that. You are absolutely correct. Grass-fed beef and free-range chicken and free-range organic eggs are more expensive. However, you can find them on sale. So we'll talk about, some more tips as far as making sure that you can integrate these things into your lifestyle quickly and easily later on. But for now, just know you can add these in when they're on sale. There's another great way to add them in, and it can help keep things within a budget. So we want to make sure we have good, clean, quality meats. If you are eating beef from a cow that is inflamed, you are eating the inflammatory components that are in that muscle tissue, and that's what we're eating. And we don't want to eat inflammation because that just adds to our inflammation. So we want to make sure that we're eating really clean sources. And again, I'm going to go back to your veggies. Any of your non-starchy veggies, we really want to look for any pesticides that are in them. So we don't have to buy organic for 100% of our veggies. I don't. There is a really amazing group, the Environmental Working Group. Their website is ewg.org. And they publish every year the list of the Dirty Dozen and the Clean 15. So I advise all of my patients take a picture of the Dirty Dozen and the Clean 15. Have it on your phone so when you go shopping, these vegetables of the Dirty Dozen notoriously have more pesticides and I need to buy them organic. Or the Clean 15, I can get away with not buying them organic and be safe because those pesticides are definitely going to interfere with our health as well. So the other really important part is having good fats. So we want to have good quality fats that we're using in the diet, cold press, first harvest, with our olive oils. All of those are going to be amazing because if we have oils that are sitting on the shelves or they're from olives that have been sitting on the tree too long and they've over ripened, they're not going to be as nutrient dense as we would like them to be. So again, having really good quality fats is super important. Hydration, that is another key part to having a really healthy diet. We want to make sure that we're well hydrated. But more importantly, we want to make sure we have plenty of good minerals. Now, you're going to get hydration from your good starchy veggies, but you also want to make sure that you can add in some extra minerals. I add minerals into my water because I use a reverse osmosis system, so it does take out a lot of that. And so I want to make sure that I'm adding in my minerals to make sure that I am getting things well hydrated within the system because it's not just water. Our cells need our minerals in order to move water in and out of the cells. And I can't tell you how many times in practice I find patients are like, oh yeah, I drink, a ton. I drink half my body weight in ounces a day. And I look at their labs and they're dehydrated. And it's because they're mineral deficient. So minerals, super important. Another thing that you can add in for diet that I think is really great is intermittent fasting. So intermittent fasting is going to be anything between 12 and 16 hours of no food. Now, having this time gives your body time to rest, digest, less digestion, but more rest, more turnover of different cells. And that is actually really good for helping us improve our immune system, help break down things that we don't need to break down, or break down things we need to break down, more inflammation, those type of things in the body. Another thing that you can do is a juice fast. I mean, that's what I'm doing right now. You can do that. That gives your body some time to take a break from digestion. It really helps the liver. It's going to help the GI, and it gets really hydrated, and you get lots of veggies in there as well. So that's another thing. So let's talk about shopping tips, because that's really a big thing for people. They say, okay, I know what foods are good. I know what I should be having, what I shouldn't, but how do I know, what to buy, and how do I make this work on a budget? So what I like to recommend is buying organic things when they're on sale. So you can buy your fruits and veggies when they're on sale. We here in Florida have Publix, and they're amazing because they do BOGO. And so I will buy my organic fruits or veggies. If I am not able to eat them and they're going to spoil, I throw them in the freezer. I can use my frozen veggies in a smoothie. Same with my berries. I can throw those in there as well. So there's plenty of options where you can get things that are on sale, and that makes it a little bit easier. You're also going to find that it's better for your budget if you eat seasonally available food. So we know that, we're going to have certain seasons where fruits are going to be more popular, and same with veggies. And so make sure you're eating those within the season, and that will help with your budget also. You can do the same thing with buying your organic meats when they're on sale. Same with using organic frozen veggies. Those are really great to throw in your soups and stews and things like that. And they're less prep and easy for you to handle. Just don't overcomplicate meals. You don't have to be Gordon Ramsay. I love Gordon Ramsay to death. I think he's an amazing chef, but I am not Gordon Ramsay. So I don't eat like Gordon Ramsay. And so I'm going to make things taste wonderful and fabulous for me, but I don't need to get all crazy with spices and make things more complicated than they have to be. So really simple is best. Really keep it to, I need this many veggies, I need this amount of meat, and I need some good fats, and call it a day. Also be realistic as far as your timelines. Okay, so for the week, I know that I can eat really clean 80% of the time. Okay, well, that's great. And then you can have a snack that may not be yours. Have your non-starchy veggie to add in on that 20% of the time. So make sure you're setting things that are realistic there. Another question that I get is replacements. So people are like, hey, I'm used to cooking Italian. Like, what am I supposed to do? I'm not supposed to have noodles. Like, what am I supposed to do with this? So a great replacement for noodles, you can use palm hearts. They're fabulous. I prefer palm hearts over spaghetti squash or zucchini, but you can add zucchini or spaghetti squash to any recipe, and that's a really great option. The other thing that I get too is fried foods. People are like, I love having like a crispy piece of fried chicken or a fried shrimp. Well, take your coconut flakes and add some arrowroot flour or some tapioca flour to that, and then put them in the air fryer with some avocado oil. And that's a really good way of getting your fried foods. They're going to taste fried to you, but they're going to be really healthy and still staying on that paleo side and with good oils, right? Again, making sure you're buying good quality oils. We want cold press. We want first harvest. You can buy coconut oil, which are really great. So buying organic coconut. I can't even speak today. I think it's because I'm just jazzed about the Gator game. So I don't know how you guys feel about Saturday college football, but I'm super stoked. So I will just blame it on that. The other really great oil that I love is avocado. I use that in my air fryer a lot, but olive oil. And I use olive oil to finish. I will cook with some olive oil, but I really like to finish my dishes with that raw olive oil to get that in and those good polyphenols. Buns. So my kid is a hamburger fiend. He would eat hamburgers every day of the week if I would let him. And so because I don't let him do that, we have to find different options because he, he'll want like a bun. And I'm like, okay, well, we can't have a bun. So let's do different things. So lettuce is a really great one. You can use that as a wrap for like your hamburgers. You can also use a portobello mushroom. So use your portobello mushroom as your hamburger bun. And again, you're not going to be able to eat it like a hamburger, eat it with a fork and knife. There's nothing wrong with that. And you're going to get a really good, satisfying meal from that. Another like sandwich option is to use cucumbers. I take the seeds and I take the seeds out of a cucumber and hollow that out. I will add whatever, my chicken or my eggs into that and have that as like a sandwich alternative. And then chips are a big thing for most patients. As far as I really love nice crunchy chips. So take your sweet potatoes or some plantains or use kale, and you can use those with some avocado or coconut oil and deep fry those in your air fry those in your air fryer. And that's a really good option as well. You can bake them. If you don't have an air fryer, you can do all of the stuff in baking as well. And that works just great. And those are really good because a lot of times when you're craving chips, you're really craving a little bit of that salt and you're just craving that crunch. So what we just need to do is replace that crunch with another good healthy crunch like kale or plantains. And that would be a good alternative. Sugars are another big thing. I don't like alternative sweeteners. Alternative sweeteners they wreck the GI tract and we definitely want to avoid those. So you can use natural sugars. I love coconut palm sugar. You can use dates to sweeten things. And you can also use, your stevia or monk fruit if you like those flavors. Those aren't really to my taste bud liking, so I don't use those as much. But again, those are really good options. So as far as diets go, that's really kind of the big basics. And I know that, Kim, am I correct that people had questions about supplements?
They did, and we have one right here that I think that is really, really important. Just taking high doses of calcium to prevent osteoporosis, increase buildup of plaque. Some doctors say yes. And I think that this is something important to address because also even with my mom, you helped her naturally be able to increase her calcium level. And it's also something that you've mentioned. You need to get a blood test. Don't just do things inadvertently or on your own. You need regular blood tests to monitor this.
Absolutely. So with any of your vitamins and minerals, I really love looking at a micronutrient panel because I could guess that maybe your vitamin C was low or maybe your calcium was low, but I don't really know unless I look at the value. So a micronutrient test is key. And your micronutrient test is going to tell you, is it high or low? And you're absolutely correct. If you are taking in excess calcium, it can cause that calcium to build up within the arteries. And what happens when we have calcium built up in the arteries is they make them brittle. And we're more prone to those breaking and tearing. And that is bad news. That's worse than them plaquing. So we don't want them to have calcium in them because that makes them super, super brittle. So be very careful with adding that in. Again, calcium, if it's added in, needs to be added in a 2-to-1 ratio with magnesium. So 2 calciums to 1 magnesium because they work synergistically together. Now, if you're trying to attack osteoporosis, another thing to look at is how are your vitamin D levels? How is your phosphorus? Because those also play a part into how we're maintaining good bone health. And it doesn't matter if you're a male or a female, it's really important to have good hormone balance because that's what really is a key part in maintaining good blood health. So again, if you're going to supplement in, I really recommend looking at a micronutrient panel because that will really tell you where things are.
Thank you so much, Dr. Hines. We really appreciate you.
Absolutely.
We have so many questions coming in. Would you take a few moments and go into comments and just type in a few answers to the questions that are coming in?
Absolutely. That'll be my pleasure.
Thank you so much, Dr. Hines with Wellspring Natural Medicine, wellspringnaturalmed.com. Am I correct?
You are absolutely correct. Thanks, Kim. It's always a pleasure.
Thank you.